Good afternoon, oral health stakeholders. Thank you to all that have joined us for the breakout session entitled Effective Preventive Practices for Schools and Communities. I am Michonne Butler and I will serve as the moderator for this session. This session will include 3 separate presentations. All attendees have been muted. Without further ado, we will begin today's presentation, Effective Preventive Practices for Schools and Communities. Our first panelist is Melissa Garcia. She is the Oral Health Coordinator for Wellhead, Louisiana.
Hello, everyone. For this breakout session, we will talk about important intervention programs that Wellhead, Louisiana offers to children statewide in schools to increase access to preventive oral health care. Next slide, please. Can you turn on your sound? Again, my name is Melissa Garcia, and I'm the Oral Health Coordinator for Wellhead, Louisiana. I oversee Louisiana Seal Smiles, which is a school-based and school-linked program that provides free preventive services and education to underserved children within their school setting. Next slide, please. The objectives for this presentation are to discuss and understand why oral health preventive practices are effective in school settings, discuss and provide information on oral health programs that are available for families at the state and local level, and to understand how oral health preventive practices in the school setting are contributing to a decrease in oral health disparities. Next slide, please. This presentation will provide you all with more information about who we are, why schools play an important role in what we do, the top oral health priorities, our partners and their reach, the barriers we have faced since COVID-19, the importance of fluoride varnish, our 3rd grade basic screening survey, and how you can get involved. Next slide. Now, I'd like to share a little bit about our work here at Wellhead, Louisiana. Wellhead, Louisiana is the chronic disease prevention and healthcare access arm of the Louisiana Department of Health. Our mission is to connect Louisiana communities to a healthier future. Next slide. Wellhead, Louisiana's Oral Health Promotion is a state-level program dedicated to improving and promoting better oral health for our residents through the use of fluoride treatments, dental sealants, and the fluoridation of community water systems. We also distribute data about oral disease, the risk factors, and correlation to other health issues, as well as the positive results seen when prevention measures are taken. Our collaborative efforts include those with federally qualified health centers, school-based health centers, the Louisiana Oral Health Coalition, other nonprofit and grassroots organizations, as well as local pediatric hospital institutions. Next slide, please. School is a child's second home, and because children spend so much time at school, promoting the importance of overall health and preventive oral health care will provide them with the lifelong skills they need to be healthy and happy. Our health is directly affected by what goes into our mouth, and without preventive oral health practices, children can develop oral health issues like gum disease and tooth decay. And over time, children will suffer from pain and discomfort that will eventually miss out on valuable classroom learning time. According to the National Center for Education Statistics, in 2018, students in Louisiana were in school for 177 days, with a minimum of 1,062 hours of instructional time, and that equals 6 hours of daily in-class instruction. So they're in class a whole lot. I know that this past year has been an exception with COVID, but hopefully as time goes on, we'll be able to go back to a different type of normal where we can be back in schools. Next slide. The oral health program focuses its work around 3 evidence-based practices: school sealant programs, fluoride varnish programs, and community water fluoridation. All of these ultimately prevent early childhood tooth decay in addition to keeping adults and older adults' teeth strong. School dental sealant programs are an evidence-based best practice for preventing tooth decay among children who are less likely than other students to receive oral health care from dentists in private practices. These dental sealant programs offer free oral health screenings and dental sealants to eligible students. Dental sealant programs can be school-based or school-linked and are conducted within the school setting using portable dental equipment, a mobile unit, or even in a clinic setting. Next slide. Without our partners, we wouldn't get anywhere with this program. Thanks to A Heck of a Smile, Eat, Move, Grow, Excelleth Primary Healthcare, and Inclusive Care, we have been able to move forward with our mission over the last few years. Louisiana Seal Smiles is a well-ahead school sealant program, which is done in partnership with dental health professionals and school administrators. For 12 years, Louisiana Seal Smiles has partnered with FQHCs, SBHCs, nonprofit organizations, and other grassroots organizations to expand school sealant programs that are school-based or school-linked. They focus on dental health care professional shortage areas, and they provide free preventive services to children 6 to 14 years of age statewide. Louisiana Seal Smiles promotes and implements dental sealants, fluoride varnish applications, and oral health education free of charge. School sealant partners rely on school participation to complete on-site clinics to screen and educate children, as well as apply dental sealants to those who need them. Our current partners have been diligently working toward the mission of the Louisiana Seal Smiles program and have initiated innovative ways to reach targeted populations in Louisiana during the pandemic from January of this year, and they'll be continuing up until the end of the school year in May. The goal is to expand school sealant programs across the state, and even after the school year finishes, they will continue on to the mission. Next slide. This map is of the dental care health professional shortage areas in Louisiana, and 86% of Louisiana residents currently live in one of these areas. As of 2018, Louisiana Seal Smiles has provided 1,459 free oral health screenings and 867 dental sealants to Louisiana children living in a dental care health professional shortage area. Effective school sealant programs result in measurable population level oral health impact and economic savings. Well Ahead Louisiana collaborates with school sealant partners to promote, coordinate, implement, and evaluate dental sealant programs within elementary, middle, and high schools located in these areas. Children that are eligible for these services attend schools where 50% of the student population qualify for federal or state free reduced meal programs. Next slide. As we all know, COVID-19 has created barriers, not just for oral health, but for every program that's out there that has to do with being in the community. Fortunately, our partners have not let that stop them. Above is just a snippet of activities that our partners have developed and initiated to reach children and families without having to physically visit the schools. The pandemic eliminated access to preventive oral health services in the school setting statewide, but with new CDC guidance and as schools continue to move forward, it will just be a matter of time before school sealant programs can start up again. Until then, partners have responded quickly to the opportunity to provide schools with resources and education on oral health, school sealant programs, and community water fluoridation. With innovative planning, partners have made it possible to provide schools, children, and parents with fact sheets, virtual newsletters, online toolkits, virtual lesson plans, virtual activities, tangible textbooks, toolbox kits with water bottles, toothbrushes, toothpaste, floss, and have also developed webinars and workshops to spread awareness and educate on the importance of oral health and overall health. Partners have made these opportunities fun, valuable, and memorable for all children, teachers, and parents that participate. These activities also serve as a great way to educate schools on services available to them and their students when schools are able to open up to our programs again. Next slide. Mhm. Sorry, everyone. We're going to get that video played for you. There we go. So this video was a part of a campaign that promoted fluoride varnish. In 2017, Well Ahead Louisiana, with the Office of Public Health, held the Louisiana Fluoride Varnish campaign to promote the delivery of fluoride applications to children in our state by pediatric providers. The application of fluoride varnish, which helps to prevent and potentially reverse early tooth decay, is 100% reimbursable by Medicaid. School Sealant partners can also apply fluoride varnish to children that participate in dental school-based or linked clinics. The fluoride varnish evaluation report found that the Louisiana Healthy Smiles Fluoride Varnish Initiative increased outreach and promotion efforts from 2015 to 2017. In this same time frame, the number of Smiles for Life certifications and providers submitting fluoride varnish reimbursement claims increased. Providers also reported to the oral health program that they will continue to provide fluoride varnish. For more information on the Smiles for Life health certifications, there is a link in the presentation. I will go on ahead and be sure to get that posted to our summit resource page as well. And I just want to look at the chat real quick here. Can I get a copy of these slides? Hi, Erica. This presentation will actually be posted on the summit webpage after our summit ends in the coming weeks. Next slide. The Basic Screening Survey is a tool for obtaining data for oral health surveillance. Well Ahead conducts the third grade Basic Screening Survey every 3 to 5 years to collect the prevalence of caries experienced, untreated tooth decay, and dental sealants among third grade students. This project, recognized as the Louisiana Bright Smiles for Bright Futures Basic Screening Survey, is funded through the Centers for Disease Control and Prevention's Division of Oral Health. The last survey that was conducted during the 2016-2017 and 2017-2018 school years. Next slide. So how do you get involved? Well Ahead Louisiana has a complete Louisiana Seal Smiles toolkit available online at wellaheadla.com/Louisiana Seal Smiles. There you'll find all the resources you need to gain support, choose a school, implement the program, and evaluate it. By working together and expanding Louisiana Seal Smiles across the state's dental HIPSA areas, we can increase the number of students who've received dental sealants by 400% in 5 years. You can help sustain the school-based dental sealant program by becoming a leader for oral health in your community and by being a part of Louisiana Seal Smiles. We have the tools and the tips to help you provide dental sealants to our most vulnerable children at all schools in mobile units or in a clinical setting within these areas. Next slide. These were the resources for the presentation. And again, this recording will be available after our summit. Next slide. For more information and resources, please don't hesitate to reach out to Well Ahead Louisiana using the contact information shown on this slide. And I'll give you a few moments if you want to take a picture of this or if you want to write this down. And that's my email address there. If you're interested in joining Louisiana Seal Smiles, please feel free to shoot me an email and I'll get back to you. Next slide. And that concludes my presentation. Thank you so much for joining us y muchas gracias.
Next, we will have Mr. J. Ray. Mr. J. Ray is the fluoridation monitor for the Wellhead, Louisiana fluoridation program. He's also the project coordinator for the Drinking Water Revolving Loan Fund program.
Welcome to the presentation on water fluoridation as an evidence-based practice for communities. Slide 2. Next slide. Next slide. Can you hear me? My name is TJ Ray, and I am the Wellhead, Louisiana Fluoridation Monitor. Slide 3, please. Next slide. The objectives of the presentation today are to define the community water fluoridation, or what we call CWF. And we're going to describe the impact of water fluoridation and share Wellhead Louisiana's efforts to expand the reach of community water fluoridation and share those public water systems in those health professional shortage areas, as well as the economically challenged areas that are providing optimally fluoridated water. Next slide. Community water fluoridation is the process of adjusting the amount of fluoride in drinking water to a level recommended for preventing tooth decay. It has been proven to be a safe, effective, and inexpensive way to promote good oral health. It's been in practice since 1945 and is considered one of the 10 great health achievements of the 20th century. CDC states for every dollar a community invests in water fluoridation, $20 are saved in dental treatments. In communities with fluoridated water, residents are encouraged to drink the tap water to benefit from this added protection. Fluoridated water improves the oral health and therefore the general health of the people of Louisiana. Next slide. Fluoride works in two ways. In children, it is taken in by the teeth while they're still developing below the gums and to help create a strong surface. And in both children and adults, the teeth are bathed in the fluoride that's in the tap water. There's acid produced in the mouth by the bacteria that pit the teeth, with the fluoride that's in the water helps the teeth become sealed to prevent up to 25% of the cavities that are normally formed. Fluoridation is the most effective way to prevent tooth decay, and best of all, when water is fluoridated, everyone can reap the benefits simply by drinking tap water. Next slide. Is water fluoridation necessary? Absolutely. CWF is more effective than brushing with fluoride toothpaste, flossing, diet, and dental checkups. It is well known that water fluoridation decreases the dental caries in all social classes. Drinking water fluoridation is equitable in its impact on oral health. Next slide. Community water fluoridation is credited with reducing tooth decay by as much as 25%, and that is above and over the effects of fluoridated products such as toothpaste and mouth rinse. 20 to 40% of cavity reductions for all, regardless of age, income level, race, ethnicity, education level, or access to dental care. CWF benefits everyone. Most importantly, it benefits those without access to regular dental care. CWF is the most efficient, safe, and cost-effective way to prevent tooth decay. Residents without community water fluoridation experience more dental problems than residents with community water fluoridation. This causes both the healthcare system and families in these communities to spend more money on dental appointments, treatment, and emergencies. In addition, residents without community water fluoridation are more likely to miss school and work due to preventable dental issues. Next slide. More than 3,000 scientific studies and research findings have been published on fluoride. The overwhelming evidence supports the safety and effectiveness of water fluoridation. It is endorsed by CDC, American Academy of Family Physicians, and the World Health Organization, and many other respected health and medical organizations. Next slide. All of our U.S. Surgeon Generals have endorsed the effectiveness of community water fluoridation. Dr. Jerome Adams, our 20th U.S. Surgeon General, stated that over the last 2 decades, oral health has improved for many Americans, but not for all. Working age adults have seen no improvements in the last 10 years, and it's costing individuals, businesses, communities, and even national security. Also, more than 50% of the Army recruits cannot be deployed because of their dental issues. Jerome says oral health is a value added, not an add-on. Next slide. Healthy communities create conditions that benefit everyone. Community water fluoridation helps all of us, the entire community, prevent unnecessary dental problems before they begin. Next slide. After water fluoridation begins, communities see an increase in the percentage of caries-free children compared to communities without water fluoridation. When the thousands of Katrina evacuees moved into the Raising Cane's River Center in Baton Rouge from Orleans and Jefferson Parish, the examining dentists were blown away by the number of kids with a lack of cavities compared to those they routinely examined in Baton Rouge, where community water fluoridation is not practiced. Next slide. Only 39% of residents in Louisiana receive the benefits of community water fluoridation compared to 75% nationally. Dental care is the #1 unmet health need among low-income children, older adults, and those with special health care needs. There are 1.8 million residents are underserved in Louisiana due to living in a dental health professional shortage area, a HIPSA. Next slide. Well Ahead's community water fluoridation work includes expanding partner relationships and giving presentations to let communities know about the benefits of fluoridated water. Next slide. We completed 8 Louisiana Rural Water Association training presentations. Those last 4 presentations were limited to 50 participants because of the COVID restrictions. And our last education series webinar presentation in 2020 was held in conjunction with the Louisiana Rural Water Association and the Louisiana Municipal Association. Next slide. Annually, the CDC Water Fluoride Quality Award recognizes those water systems that adjust their fluoride concentration in their drinking water and achieve a monthly average fluoride level that is within the CDC recommended optimum range of 0.6 to 1 part per million. Those public water supplies that are in the dental HEPSA areas that have received awards for serving optimally fluoridated water include the town of Walker and multiple Fort Polk water systems, Natchitoches, Calcasieu Parish Water District number 1, multiple water districts in St. John Parish, DeRidder, Thibodaux, Shreveport, Bossier City, and Vidalia. Orleans, Jefferson, and Plaquemines parishes have multiple water systems that provide optimally fluoridated water to low-income populations. Because these water systems are fluoridating, they are helping to protect the oral health of the residents who reside in those areas that are underserved by dental health professionals. Next slide. Approximately 89% of Louisianans receive their drinking water from community water systems. Currently, Louisiana ranks 46 among 50 states and the District of Columbia, with only 39% of the residents receiving fluoridated water. This map shows the location of the public water facilities that provide optimally fluoridated water that are within and without parishes designated as HEPSAs. The circles represent those water systems that are fluoridating that have 5,000 or more service connections, and the triangles represent those systems that have less than 5,000 service connections. Next slide. Water fluoridation resources. We have a community water fluoridation toolkit that can be viewed on the Well Ahead Louisiana website. This page explains the benefits of fluoridated water, reviews the requirements and responsibilities, and provides resources for public water system operators to either fluoridate their water or to maintain optimal fluoridation levels. Next slide. Currently, there are 49 water systems with 5,000 plus water connections. Of the 49, 32 systems do not fluoridate and 17 systems do fluoridate. Next slide. For information and resources, please do not hesitate to reach out to Well Ahead Louisiana using the contact information shown on this slide. As a reminder, an evaluation survey will be sent at the end of this webinar. Please take the time to complete it. Thank you for joining this breakout session. That's it.
Next, we will have Shelly Lopez. She is the director of the Ambulatory Nursing Practice at Children's Hospital in New Orleans.
All right, thank you so much, Michonne. Good afternoon, everybody. Thank you again to the Louisiana Oral Health Summit for allowing me to speak today. So as Michonne mentioned, my name is Shelly Lopez, and I'm a director of Ambulatory Nursing Practice at Children's Hospital. I've been a registered nurse for about 25 years, with the majority of that experience being in the outpatient pediatric setting. I'm responsible for clinical education and clinical practice for the entire ambulatory division of Children's. And we currently provide services to patients in about 20 different locations throughout the state of Louisiana. My agenda today will be to give you a background of Children's Hospital, discuss the plans that we have in place to improve pediatric oral health and wellness, and also discuss the plans we already have in place to promote wellness to our pediatric population. Next slide, please. All right, so first a little background of Children's Hospital. We were founded in 1955, and we are proud to be the first and largest full-service hospital for children in Louisiana and the Gulf South. We provide primary care services as well as services for 40 different subspecialties, and we employ over 400 providers. That's nurse practitioners and doctors as well. Last year, we cared for patients in all 64 parishes of the state, 43 states in the nation, and 9 countries worldwide. The image you see here is the rendering of the final result of our multi-million-dollar campus transformation. This is on track to be completed later this year. We're located in Uptown New Orleans, next door to the Audubon Zoo and along the Mississippi River. We're also the founding member of LCMC Health System. That's a partnership made up of 6 different hospitals in the greater New Orleans area. And we've grown this hospital healthcare system to be built to serve the unique needs of our community and families along the Gulf Coast. We believe in treating the whole patient, not just the condition. But at Children's, we strive to treat everyone like family. We strive ourselves to give those little something extras and make every experience unique. This is reflected in our values, which we call SHANOLA values. It's an acronym that mimics Children's Hospital of New Orleans. That stands for caring, honor, nice, ownership, leadership, and advocacy. And it's the value of caring that comes to mind when we talk about pediatric oral health and wellness. So let's talk about what we can do for our little kiddos. Next slide, please. So why are we here today? Well, it's because of the information shared here. These pictures were taken from the Well Ahead Louisiana website, and it reinforces what Mr. Ray said a little bit ago. Dental care is the #1 unmet healthcare need of our state. 1.8 million Louisiana residents are underserved due to dental professional shortage areas. Most of us are familiar with the Superdome. So 1.8 million people will fill that Superdome about 23 times. So that's a lot of people. So that's where we want to help, especially when it comes to the children of our community and our state. Children's Hospital's vision is to be the regional medical center for kids. And while, yes, that includes the usual things like primary pediatrics, cardiology, orthopedics, the usual specialty things, we absolutely acknowledge that dental health is just as important as a subspecialty. Next slide, please. So when it comes to kids, we speak their language. When we were invited to participate in this project, we had many, many ideas flowing. But if there's a child in need, no matter what that need is, we want to help. That being said, I'm going to be introducing just a few of the resources we have coming up and a few of the resources already in place with Children's. Next slide, please. So first, I'd like to virtually introduce you to Dr. Suzanne Fournier. She is our dental line service chief at Children's Hospital of New Orleans. She has a heart of gold, and she has an absolute vested interest in community health and support. She serves as Louisiana's public policy advocate for the American Academy of Pediatric Dentistry, and she's also a board member for the New Orleans Dental Association. Another little fun fact about Dr. Fournier, she is fluent in Spanish. So that's a big asset to the children of our community who do not have English as their first language. Dr. Fournier will be participating in some live webinars with the Oral Health Coalition later this year. The topic she plans to discuss is processes for dental emergencies and also the effects of the COVID-19 pandemic on nutrition and oral health. Next slide, please. I think that one might be out of order, but that's okay. We'll come back to that one. So we want to establish Children's Hospital as a dental home for the kids of our community, but also statewide. So what does that even mean? We're a hospital, but we have dental services as well. Well, it's exactly what you think it is. We can offer the usual and customary items like cleanings, checkups, cavity fillings, sealants and crowns. We can even do tooth extractions and give oral and dietary counseling. But we're also dedicated to some other unique situations and those special needs situations. So some examples might be tooth spacing maintenance, trauma follow-up and maintenance. Also some interceptive orthodontics, care for special needs patients. And if necessary, we can do comprehensive treatments under general anesthesia if we have to. So just to break up the little monotony just for a second, we talked about some trauma management. If you wanted to open up the chat box, I have a question for you. So let's say you're at school one day and a little one comes up to you with their permanent tooth right in their hand. It accidentally got knocked out. What would you do? You want to put that in the chat box? I'll check it for a second. See if anybody has a thought. Back in. Good option. Anybody else? Reinsert it and put it in milk. A few more seconds. Anybody else want to chime in? Great. Thank you guys so much for participating. So actually, most of you are correct. Dr. Fournier recommends that you can either put the tooth in milk. So kudos to you who thought about that option. There's also a solution called Hank's Balanced Salt Solution, also known as Save-A-Tooth. You could put in either one of those solutions until the child is able to see a dentist like Dr. Fournier. So thank you to the few of you who are able to play along with me. But any child can be seen in our dental office at Children's Hospital. You can call to make an appointment at 504-896-9857 and select option 2. We also have a lot of information on our website. I have a link with that contact information at the end of this presentation. Next slide, please. All right, so the next resource I'd like to introduce you to is Thrive Kids. This is our student wellness project. Now, under normal circumstances, our kids spend most of their day at school, but we know COVID-19 had different plans for us this last year. But again, this is another way that we're bridging healthcare gaps. We're bringing care where the kids are. So we're bringing innovative school-based program to them during the school day to advance health and well-being, and that includes oral health. So this program involves a laundry list of options that are available. It could use in-school virtual care, mental and behavioral health services, chronic care management. We've done a lot of work, of course, with COVID-19 support. We also have a dedicated nurse hotline that's available to anybody in the state. And we have educational resources on the Thrive Kids website. Next slide, please. So I'm assuming that you've heard by now, we have this little pandemic going on named COVID-19, right? But Thrive Kids program has been instrumental in helping our students and our school staff get back into school safely. We've hosted 27 different town halls, and when we were analyzing and just really trying to deep dive and determine were they helpful, we realized these town halls were viewed over 5,000 times and in 54 different parishes of our state. That's amazing. We've also offered medical consultation and guidance so that schools statewide can implement Louisiana Department of Education guidelines and CDC guidelines to keep everyone safe. We've also established a mobile drive-through testing site for patients, families that might be symptomatic or exposed to somebody that was symptomatic. The drive-through site, we give them same-day results. And then this past February, we started vaccination efforts with our schools, partners, and staff. But putting COVID aside for just a second and looking towards the future, it's the same team with Thrive Kids that's going to be hopefully going back into the schools to really meet with our partners and the students to give some extra healthcare classes. And one of those topics to be discussed, of course, will be oral health and wellness. Next slide, please. Next, I'd like to virtually introduce you to Dr. Denise Carute. She is our community pediatrician. She participates in our Thrive Kids virtual care. So in-school virtual care will allow students to stay at school. Our partnered school staff will help them get set up on a virtual visit if needed, and parents and guardians can actually participate in this video visit. They can become part of the video visit or they can call in to hear what's happening. It's just a way to get care to them immediately. Dr. Carute can help make medical determinations, but oral health and wellness is no exception. She can facilitate needed resources like facilitating referrals to Dr. Fournier's team in the dental division here at Children's Hospital if needed. Next slide, please. So we also mentioned that we have that dedicated nurse hotline. Phone number is posted here. And as I mentioned earlier, it has a wide variety of options and resources with one phone call. Daily call volume fluctuates, of course, depending on what's going on. On a busiest day, we've had over 185 calls to this hotline, but we average about 40 in a daytime. But again, this is a way to get in touch with those virtual visits. We can facilitate appointments that might be needed for oral health and wellness or chronic condition management like asthma, diabetes, seizures. All of those things are on the table when it comes to this hotline. We can also facilitate other appointments, again, COVID-19 support, educational resources and guidance is all available there as well. It's basically an easy button and a way to fill in the gap for anything that a child might need. Next slide, please. So going back just a little bit to our fluoridated water supply, Dr. Fournier is also planning to offer some educational in-services to our children's hospital providers, especially our children's hospital pediatricians, at the start of the 2021-2022 school year. She plans on highlighting our area fluoridated water supply and also promoting oral health awareness during kiddos' annual wellness visits. So just one more thing to just peek at while the pediatricians are giving their head-to-toe assessment. And if we determine that there's a need for dental care, she's happy to assist. And it's our hope that all of these educational sessions and resources will prompt and increase awareness for the kids of our area. As I stated earlier, Dr. Fournier is eager to fill these healthcare gaps, and she and her team are absolutely humbled and hoping that we can serve as a dental home for Children's Hospital and the kids of our state. Next slide, please. So with that being said, as I've said probably 3 times already before, Children's Hospital, there's no job too big or small when it comes to us with the needs of kids. We absolutely want to be your easy button. So if there's anything that we can do to facilitate or help you with oral health and wellness of children, you can visit our website at www.shanola.org/dentistry, or you can email us directly through the Thrive Kids program. That email address is thrivekids@lcmchealth.org. That concludes my part for today's summit. Thank you guys so much. I hope you found it helpful.
Thanks to all of our presenters. We will now take questions. I will facilitate the Q&A session. If you have a question, please type it in the Q&A box. Questions should be addressed to the presenter that you would like to address the question. And we don't have any there. Let's see if you have any in the chat.
Mashawn, I see one for me in the chat. If you don't mind, I'll go ahead and answer that one.
Okay, let's start from the beginning.
Sure, no problem.
I think one said, just so we can make sure that we catch everyone quickly, can I get a copy of these slides? Like Melissa said, the slides will be available on the website. But for you strictly, asking here, we'll definitely, make sure that you get those, Ms. Crawford. Let's see. What school staff members does the school-based virtual care work directly with? For Shelly?
Yes, ma'am, I can help to answer that. So the school staff, we actually supply a laptop with the camera in it to assist with the virtual visits. So if a kiddo needed to be seen, say they lost that tooth during the school day and the staff wasn't quite sure what to do, there's a phone number on the laptop that you call to set up the virtual visit. We can also then alert the family that we're setting up this visit, and the school staff just assists the child with getting positioned and in the camera angle to talk to Dr. Karut. Hopefully that answered your question. If not, let me know.
Do we have any additional questions? Okay. So please complete the summit evaluation. You can find a link to the evaluation in the chat. We also ask that you complete the survey, as your responses will help guide us in planning the 2022 summit. Again, like I said, the link should be in the chat, and you will also receive an email, but we're asking that you go ahead and do that now so that we can get those coming in. We value your thoughts and we look forward to reviewing those. As far as our summit resources, we ask that you take some time to review that summit webpage. There's a lot of information there. And so it'd be great, for you guys to take a moment to go there sometime throughout the day or right after this. Also, a link is provided in the chat. It's also was a part of your registration. Lastly, all the presentations we have been recorded and will be available on that webpage in the future. But again, if you have any questions, those emails that were provided, please feel free to send us an email. So if you have any final other questions, again, you can provide, you can send them to the coalition. And then also, if you would like to be a member of the Louisiana Oral Health Coalition, please join. You can send an email to that coalition's web email address and ask for information. And we have a process where we take information and we send you additional resources and then have you on board as a member. You take a survey, and then after that, you will immediately begin to receive updates and announcements and information about upcoming meetings and etc. And also below is information on our executive officers, but we also have a question, I think that's come through in the chat. 1 second. I just said we'll do it. Thank you. Let's see. In the chat. Okay, let's see. We'll do Taffy. That's it. Okay, Taffy, we'll be sure to send you information on that. Thank you. So thank you for joining us. On behalf of the Louisiana Oral Health Coalition and Well Ahead Louisiana, we'd like to thank you for joining us today. This concludes our 2021 Oral Health Summit. We hope that this was a day you remember. Let's put our seatbelts on and brace for the ride. The road ahead is full of challenges, but just as many wins. Thank you for investing in our plan to achieve better oral health access and equity for every Louisianian. See you in 2022. Have a great rest of your day.